topic to discuss in osteology, the vertebral column. If we will classify the vertebral column, we need to know that in vertebral column we have 33 vertebrae, and these vertebrae are divided in different sections. Okay, cervical sections, thoracic section, lumbar section, and sacrum and coccyx. Okay, now I will show how many we have cervical vertebra, how many we have thoracic vertebra, how many we have lumbar vertebra, and sacrum and coccyx. First, from the C1 to C7 we have cervical vertebra. Okay, and then each cervical vertebra we have different structure. Okay, then we have from T1 to T12 we have thoracic vertebra. Okay, and then third section we have lumbar section, which from L1 to L5 we have lumbar section, and from S1 to S5 we have sacrum, which are fused each other, and also coccyx, which are 3 to 5 also fuse each other. These are the simple classification of vertebral column which we need to know. Now we will continue about the each vertebra structure. Okay, and which is need to know, because this is the means of osteology. Region and cervical region we have 7 cervical vertebra. Okay, from C1 to C7, which I already told in classification. Okay, now we will take now we will going to discuss each vertebra. Okay, this is the cervical section. Okay, which we have C1 to C7, C1 to C7. Okay, these are the cervical region or cervical region. Okay, now we will first of all we have the first vertebra. Okay, this is the cervical vertebra. Okay, this is the first cervical vertebra, which its own name atlas. Okay, don't forget, because the C1 is its own name. Maybe if in exam come what is the name of the first cervical vertebra, it's you need to remember its own name is atlas. Okay, this is the posterior view, and this is the anterior view, and this is the posterior view. Okay, you can imagine the interior view we have body, and posterior view we have spine process of each vertebra. Okay, now we're discussing the atlas. Okay, this is the first cervical vertebra, which I already show here. Okay, now I will show what we have here. Now if we will talk about atlas, I can say to you atlas have no body. Okay, this is the difference from all other vertebra. Cervical we have no vertebra. If in exam came which vertebra have no body, you can say directly, or if we will ask in viva, you can say atlas have no body, and body mean in Latin corpus. Okay, you need to remember these three main words, like we will also discuss in next classes. Body mean in Latin corpus, neck mean column, and we will going to discuss an arch mean arcus. But here we have important information. This anterior view, which I said to you, we have body anterior view from anterior, and this is the posterior view. Okay, from P posterior view. Now we have formation. This is here, if you can look here, we have anterior tubercle, here we have posterior tubercle. Okay, why? Because this is from anterior side and this from the posterior side. This is anterior tubercle and posterior tubercle. Okay, now if you look, the C1 atlas is articulating when they are making a joint. They are articulating with the skull. Okay, through skull, where the articulating process here we can say this is the superior articulating process of atlas. Okay, both side we have two superior articulating process. This is superior articulating process. Next formation we have, this one is transverse foramina. Okay, one thing more, you can find transverse foramina only in cervical region of vertebral column, because in this transverse foramina passing the vertebral artery. Other regions of vertebrae like thoracic, lumbar, and sacrum, we have no transverse foramina, because transverse foramina only for vertebral artery. Okay, Remember, in only we can find, if we will talk about the formation, and we can ask the question what is the formation of C1 or C2, and if there you can find the between the two transverse process, you can find their whole. It's mean this is a transverse foramina, okay, which I saw. This is transverse foramina. Then we have, this is transverse process both side, okay, right and left both side, okay, it's transverse process. And here you can, this is anterior arcus and this is the posterior arcus, okay, and this area, this is the vertebral foramina, which are all vertebrae have this foramina, okay, and here we have spinal cord. These are the formation. And one thing more, okay, here if I will can show you here, the in C1 atlas vertebra, you can find here lateral masses, okay, this is the lateral masses. You can see this is the lateral masses which are present in C1 atlas vertebra. This is the formation which I told, this in C1. And here one more formation here is, this is the groove or sulcus in Latin language, and groove are in English, we can say. These are the groove for vertebral artery. Because why? Because when the artery passing in the all region of cervical region, the vertebral artery passing, and when they are entering in the skull, okay, through this sulcus. Because sulcus, where the sulcus, we can talk about the sulcus, it's mean where there are artery or veins or some other vessel are passing, okay. This it's mean here we have groove for vertebral artery, this area which I highlighted, okay. It's mean this is a vertebral. These are the formation, okay. Again we going to repeat, okay. All formation. First we have no body, okay, no corpus. Then we have superior articulant process both side. This is superior articular process. We have anterior tubercle, posterior tubercle, anterior arcus, posterior arcus, okay, vertebral foramina. We have transverse process. These are the transverse process. This one, these are the transverse process. Between them we have transverse foramina, and here we have vertebral groove or vertebral artery. These are all formation about the which vertebra? C1 atlas vertebra, okay. These are the all formation about atlas vertebra. Now we will continue the second vertebra, and it's the same like C1 vertebra. The C2 we have C2, okay, and C2 is its own name is axis, okay. Why its name is axis? Because here you can see easily we have dense process, dense or on tight process. These are the dense process which are located in the C2 vertebra. We already discussed in the C1, okay. C1 we have the parts which arcus, and we have no body, corpus, okay. We have no corpus, I already told. In atlas we have no body, okay. But here first of all you can say, here we can see we have two parts. What parts? Here you can see this is the body, this is arcus vertebra, this is arcus vertebra, okay, which arcus vertebra, and body you can see here from the down. These are the body, these are the body. It means we have body here, except C1 vertebra, others vertebra we have corpus or body, okay. Now we will continue the formations. The same formation which I already told in cervical vertebra, you can find the transverse foramina where the vertebral arteries lying, okay. Now again I will continue here. I already told we have two parts, arcus vertebra and body and corpus or body of vertebra. Now we will going to continue about the formation of axis vertebra. We have articulating process, superior articulating process, okay. We have transverse foramina, okay, both side. Here we have transverse foramina, you can see here from here, look, here we have transverse foramina, okay, and we have transverse process, okay. And here we have anterior, from why interior, this one anterior articular, and this is posterior tubercle. You can say interior tubercle and posterior tubercle. Why? Because in this one from interior to the body side, and this one from back to the spine process, okay. Next formation we have we have the vertebral column, which we have present in all vertebra. Then we have, if they are connecting the body, they are called lamina. If they are connecting the spine process, they are pedicles. Okay, and this is the spine process. And you can also see here we have bifurcation. Okay, sometimes we can find in some bodies the bifurcation from C3 to C6 cervical vertebra, but here also you can see we have bifurcations. Okay, these are the formation about the C-axis 2 vertebra. And one thing more which I told you, here you can see this is a, here I will show the on-tight process, a dent process. You can see this is the dent process, and here we have anterior articulating process, interior facets, this interior facet. Okay, and here we have posterior facet, the back side. Here we have posterior facets. Here we have posterior facet. This facet, when, because if you remember when in prison, and some people like from the court, and they saying to hang this person, that time when they will put the how I can to say this these two vertebrae is very important here for the hanging. Okay, when they are broken directly, the person, the airway will be stopped and he will be died. Okay, one thing, other formation, if we can discuss, we already discussed, we have two parts, corpus vertebra and corpus vertebra, orcus vertebra. These are the two body vertebra. The corpus and orcus, it's mean these are in Latin. Okay, because here also you need to remember the name in Latin. We have body vertebra, we have arch of vertebra, then we have formation, superior articulating process, inferior articulating process. Inferior you can find from the down here. Okay, here we have inferior articulating process, because superior articulate with the C1 and inferior articulating with the C3 vertebra, cervical vertebra. Then we have transverse foramina. You can see here transverse foramina, we are the vertebral artery lying. Okay, then we have here we have vertebral canal, where from the spinal cord. Then we have bifurcation here and spinal process. These are all the formation of the C2 axis vertebra. Okay, mostly the formations are the same in vertebra, but there we have like the extra formation which are they are differentiated from the other vertebrae. Okay, these are the formation about the C2 vertebra, axis vertebra. Okay, now we're going to continue the C3 vertebra. But remember, from C3 to C6 cervical vertebra have the same structure. Okay, but what thing they have different from the other vertebra? They have bifurcation. Okay, now from here we can see 1 2 3 4 5 6. Okay, here, sorry, here you can see 6. These are the from C3 to C6 cervical vertebra. They have same formation like the C2. We have body, corpus vertebra, we have transverse foramina, we have transverse process, we have spinal process. Okay, and we have vertebral canal. And which thing we have different from the other vertebra? Now I will going to show from if you look from the posterior side, you can find here the bifurcation. These are the bifurcation you can see here. You know, this is the bifurcation process, bifurcation process or bified process, which are located in these vertebrae. Okay, these are the bifurcation process which are different from the other cervical vertebra. Okay, these are C3 to C6 vertebra structure. Now we will going to talk about the C7 and C7, the name is prominence. Why prominence? We will going to discuss. This one, the C7 cervical vertebra. Okay, you can look, you will be know here. This one, look, we have no bifurcation. Here you can see we have prominence. Okay, this is the prominence which we can say we can palpate it from the back side of the our neck. Okay, this is the prominence, and other formation are the same. Like we have body, we have arcus vertebra, we have corpus vertebra, we have transverse foramina, transverse process, spinal process, but the end of the spinal process we have here prominence. Okay, we have vertebral canal, we have superior and inferior articulating facets. Okay, this thoracic region we have, I already told, we have from T1 to T12 vertebra we have in thoracic region, but this vertebra we have some formation same and some formation we have which are they are differentiate from the other regions. Which formation? Now we will going to discuss this formation. Okay, first of all we will take from T1. T1 is also different from the other thoracic vertebra. These are the T1 thoracic vertebra. T1 thoracic vertebra. Okay, if I will show, this is a first thoracic vertebra. Okay, this is the first thoracic vertebra. We have two parts. First we have body and arcus. We have body of vertebra and arch of vertebra, corpus vertebra and arch vertebra. These are the two main parts which we have in each vertebral body except atlas. Okay, then we have other formation which are similarity to the other vertebra. Okay, which formation? Now I'm going to show. If you can look here, we have superior articulating surface and inferior articulating surface. Okay, this is superior articulating surface, and inferior you can from the down we have vertebral canal and we have transverse process. You know what thing we have not here? We have no transverse foramina, because I told transverse foramina you can find only in cervical bodies. Okay, because if you look to the transverse process area, we have no foramina here. Okay, it's mean we have transverse process here. These are the transverse process. Okay, these are formation superior articulating, inferior articulating from here from the down. Okay, which are articulating from the other vertebrae T2. Okay, and what thing we have different here? You know why? Because these thoracic vertebra articulate with thoracic cage. Okay, thoracic cage we have ribs, and these ribs are coming here from the down from posterior side to articulate with vertebra. Here we have, now we will differentiate these thoracic vertebra from the other vertebra. We have which formation is different from the other vertebrae. Okay, look at here, we have facets. Okay, but in T1 we have one full facet. This is a one full facet and one half demifacets. This is the half. Look here, this is the half demifacets. Okay, it's mean in T1 thoracic vertebra we have one full facet and one half demifacets. Okay, these are the formation which are separate from the cervical region. Okay, and T1 separate from the other thoracic vertebra because we have one full facet and one half demifacets. Okay, other formation are the same parts: corpus vertebra, vertebral and arcus vertebra. We have spine process, transverse process. We have vertebral canal. Okay, superior articulating surface and inferior articulating surface. Okay, these are the thoracic. Okay, now we will going to the other vertebrae. This one about the T1. Now from T2 to T9 have the same structure. Why the same structure? Other parts are the same, formation are the same, but the thing which you need to know to look the dorsal lateral surface. These are the dorsal lateral surface. You need to remember the terminology also, and what is anterior, posterior, lateral, and this is for each before starting the anatomy, you need to study terminology. Okay, what is interior, what is posterior, superior and inferior. If you know this, they are very easy to identify the each structure of body, maybe bone, maybe artery, veins, muscles, borders, or etc. Okay, now when we will talk about the thoracic vertebra, we always look to the which area of thoracic in the body, dorsolateral surface. These are the dorsolateral surface, which are where we finding the facets, where facets means here articulating area, where the rib articulate with the thoracic vertebra. Okay, now I told T1 we discuss, from T2 to T9 we have T2 to T9 we have same structure. Why? Because we have two facet, two demi facet. Why two demi facet? Now I will show to which demi facet we have. Here you can look, this is the superior articulating facet, and here we have inferior articulating. Then we have superior articulating facet, inferior articulating facet, superior articulating facet, inferior articulating facet, superior and inferior, and etc. till the T9 vertebra. That's why we can say T2 to T9 we have the two demi facet, superior superior costal facet and inferior costal facet. These are the costal facet in from T2 to T9. Okay, other process are the same. Okay, spine process, like here this is a spine process. Okay, the transverse process, then when vertebral canal, then we have here the between between the vertebra articulating area, there we have superior articulating surface and inferior articulating surface. Okay, facets are, and also superior and inferior articulating process you can find in the each vertebra are the same. Okay, now these are we discussed from T1, different from the other thoracic vertebra from T2 to T1 and T2 to T9, but here the T10 is also different. T10 you can find here one facet, one demi facet, and this only superior costal facet. Okay, then T11 and T12 we have, you can find one full facets. Okay, where the floating ribs articulate. Okay, just floating ribs articulate here in T11 and T12, and other formation are the same. Transverse process. Okay, you can the transverse process, spine process, vertebral body, arch body, superior articulating and inferior articulating area, and vertebral canal. These are formation are the same in all vertebrae. Okay, except at least some have different formation. Okay, now if you can talk about the another region, lumbar region, we have from L1 to L5 we have lumbar vertebra. They have like little bit big body shape, but this is a not big differentiated if you can differentiate from the thoracic. Okay, because in thoracic also T10, T11 and T12, if you can see, they have also the big body. Okay, big body, but the most important thing in L1 in lumbar region we have very different process. You can, there we have two more processes. Actually in each vertebra we have seven processes, like transfer process, two transfer process, one spine process, and four articulating process. The two superior and two inferior. Superior mean articulating with the next vertebra, and inferior is like from the down vertebra. Okay, we are discussing the lumbar region. Then we need to take one lumbar vertebra, and we will see the structure of the lumbar vertebra. If we'll talk about the lumbar vertebra here, we have two more formation. This is a difference in lumbar region vertebra. Some students are saying like if we will ask the question, what is the difference in the between thoracic and lumbar vertebra, they can say lumbar vertebra have big body. No, I already told T10, T11, T12 have also a big body. No, this is the not big difference. The big difference, if you can see here, Then you can say like the spine, they have short spine process is also the difference. Now these are like very not the most important differentiation. The more important differentiation is two more processes, and these two more processes are one accessory process and one mammillary process, and this accessory and mammillary process we will going to discuss. First we will going to discuss from the starting, like we have, if we will talk about, we have body vertebra, we have arch of vertebra, corpus of vertebra, and arch of arcus of vertebra. These are the like in Latin language. Okay, now formation, if we talk formation, we have transverse process. Okay, from the opposite side also transverse process, spine process. Okay, we have articulating, superior articulating. Okay, and here inferior articulating processes. Okay, now, and then we have vertebral canal. This vertebral canal are same in each vertebra and articulating process also. Okay, and body and arch except atlas. Okay, now we will discussing the main difference which are different from the thoracic. Okay, because each, like simply I told like 7 process, but here we have 2 more process. Which 2 more process? This is, I will show, this is accessory process. Okay, and this is the, sorry, this is the mammillary process, and this is accessory process. These are the 2 more process which are only present in lumbar region from L1 to L5. This is the formation about the lumbar region. Okay, next section we have sacral section or sacrum. You can say sacrum bone or sacrum. Okay, os means os, the Latin name, and in English is, we can say, the bone. Os sacrum or sacrum bone or sacral os sacrum. Okay, there are also 5 vertebra, but they are fused each other during development. Okay, if you will talk about the structure, now we have surfaces. We have you can say 2 or 3 surface. We have this one, anterior view, anterior surface. This is the lateral view or lateral surface, and from the back you can see this is the, we can see posterior surface. This is a posterior surface. These are the posterior surface. Okay, now in anatomically they have also have surfaces, like in for posterior surface we can use, this is a dorsal surface. Okay, we can use a dorsal surface, and for interior we can use, we have ventral surface or pelvic surface. Okay, because this is a pelvic area, and we can say this is a pelvic surface, interior surface, or ventral surface. This is the one name. Okay, 3 name surface of one area. Okay, and now we will talk about after each surface in sacrum bone formation. Okay, if you look from the start from the anterior surface, we have first, we have the articulating surface, which are articulating, we can say this is superior articulating process, which are articulating with the inferior articulating process of the L5 vertebra. Then they making a sacroiliac the lumbosacral joints. Okay, L5 lumbosacral joints, articulating surface, inferior articulating process of L5, and superior articulating process of a sacrum bone. Then they're making lumbosacral joints. But this is not joint points. We are discussing osteology. Okay, we will come to our topic. Okay, we was discussing the anterior surface formation. I told we have superior articulating process, which are articulating with lumbar vertebra. Then we have here interior, we can find here sacral promontory. Second formation, we have 1 2 3 4 4 or 5. We have, this is the anterior sacral foramens. These are the anterior sacral foramens. Okay, from the interior view. Okay, and then you can see here when they are fused each other, each body of sacral vertebra, because these are the bodies, these are the bodies of each vertebra. Okay, here also have body, you can say, and look, these are the bodies. Now if you will talk about this body are fused each other, which I told, these are transverse lining. These, between them we have transverse ridges or transverse lines. These are the all formation about the anterior surface. Now we will going to discuss the posterior posterior surface of a sacrum bone or sacral region. Okay, here you can, from posterior side you can look, we also have posterior sacral foramens. You can see posterior sacral foramens. Okay, then next formation we have here, the important second formation, we have sacral crest. This is the median sacral crest, this is the intermediate sacral crest, and this is the lateral sacral crest. We have three sacral crests which are located in the posterior surface of the sacrum bone. We have median one, intermediate one, and lateral sacral crest. Okay, which are located in the posterior surface of the sacrum bone. Next formation we have here hiatus, sacral hiatus. Okay, sacral hiatus, these are transverse processes, which these are transverse process. Okay, and these are the formation about the posterior surface of the sacrum. Now we will going to the lateral surface of sacrum. If you look from here, okay, you can find here sacral tuberosity and auricular surface. Auricular surface or auricular surface. Why articulating surface or auricular surface? Because auricle means from like related to the ear, like ear, and they shape like ear, human ear. That's why it's auricular surface, and these are articulated with the hip bone. Okay, the hip bone in lower limb, and then they will making a sacroiliac joint. Okay, this is about the upper limb formation. Next, if we will talk about the next region, we have coccyx. The last we have coccyx or tailbone, they also from 3 to 5 and fuse each other.